It's expanded my circumference of awareness because end of life is a topic no one wants to talk about, but there's a fact. None of us are getting out of here alive. Because of that, you may as well get really better acquainted with your options about end of life and understand what's available. And we got lucky. Capital Caring was amazing. Most loving, compassionate people I've ever seen in my life that see death on a day-to-day basis, and they still come in to the facility with a smile and warmth. My mother, who had lived in Northern Virginia at that time, had been fighting for her life with stage 4 cancer. It got to a point where my mother had to be administered to an inpatient facility. And I didn't know what that meant or that transition would be like until the first day I walked into the facility in Arlington, Virginia. And it was that impression that I got that really kind of gave me a paradigm shift, and it completely changed my views about what hospice is. The initial impression of hospice, before I'd even ever been into a facility like Capital Caring, has been a hospital-like sterile environment. And it was so opposite of what I thought the entire time. And it was, especially the Hospice Center in Arlington, Virginia, it was as if you walked in someone's home. There was a living room to the right, couches. It was around Christmas time. Christmas tree was still up. They had a hot chocolate stand there for the residents. And it was a very warmly lit environment. And the staff was just a loving, happy staff. The people that work at Hospice work there because they love what they do. They don't do it for the money. Because they see death on a daily basis. So that, to me, that's a special person. That's a person that's accustomed to helping people go into the afterlife. And there's only a handful of people that can do that. And it's those people at Hospice that I met. It really will change your perspective on compassion and seeing compassion on a day-to-day basis. And we were there that entire weekend, my brother and I, and we saw several people pass away within hours of being there. And we would see those rooms change and allow room for other people to come in. But in doing so, we also walked by those rooms many times when those people were alive, seeing those nurses calmly, softly talk to those patients, rubbing their hands, rubbing their arms, telling them everything's going to be okay. We're here for you. Nothing's going to happen. Nothing to worry about. And that level of care, I just can't really, I'm speechless. It's hard to encapsulate that emotion that I felt and that I saw. Capital Caring is a special place.